Hi everyone, welcome to our channel. I am Dr. Amit Goswami. I am a laparoscopic and bariatric surgeon practicing in Gurgaon with over 20 years of experience. Today we are talking about a topic that's very important for anyone who has just had or is planning to have a hernia surgery. So whether you have undergone open or laparoscopic repair, knowing what you expect or how to take care of yourself after surgery is the key to a smooth and safe recovery. Don't forget to like this video, subscribe to my channel and hit the notification bell so you never miss an update. So let's get started. Do you know what happens immediately after hernia surgery? Right after the surgery, you will spend a few hours, say for 1.5 to 2 hours in a recovery room. If it's a laparoscopic procedure, many patients can go home on the same or next day. For open surgery or some complex cases, you might be advised to stay for a couple of days, maybe 3 to 4 days in hospital, depending on the type of surgery. You may feel sore or bloated initially, especially around the surgical site or port site. Don't worry, that's completely normal. Your body is healing, and so the discomfort usually improves within a few days in a descending curve. Let's talk about post-hernia surgery care. Here are some key tips. So how you need to take the wound care. Keep the incision or port site clean and dry. You can usually shower after 24 to 48 hours unless told otherwise. Avoid tub baths until complete healing. Medications. Medications should always be on prescription by the physician. Over-the-counter painkillers may help with minor pain. Gentle walking is encouraged from day 1 to prevent blood clots and promote healing. But avoid lifting anything for at least 1 month, that is 4 to 6 weeks. So far as diet is concerned, start with light, easy to digest food. I advise my patients to go with small, frequent meals. Take plenty of water to help prevent constipation along with sufficient fiber which can strain the repaired area. Do not indulge in eating heavy or fast foods. For healing, what are the precautions to take? Here are some important hernia healing tips and precautions. You should avoid smoking. Why? Because smoking delays healing and increases the risk of recurrence. You should cough carefully. Support your wound with some pillow or your palm of your hand, or better is you are advised to use abdominal binder for the initial days. Don't rush back to work or gym. Depending on your job, you may need 1 to 2 weeks for desk work or 4 to 6 weeks for physically active work. Always start with mild exercise, then gradually move to weight training in couple of months. Listen to your body. I believe our body tells us everything. You need to perceive what your body is telling. So pain is a signal. If something goes wrong, you are not feeling okay, you should take rest. A common question I get is, when should I come back for checkup, or how many times do I have to revisit? Here is what I recommend. First follow-up visit is typically at the end of first week. We'll check the incision, remove any sutures or staples if needed, and ensure you are healing well. Second visit, it is preferable around 4 to 6 weeks you need to visit again to clear you for normal activity and work. But don't wait for your appointment if you notice some untoward symptoms like redness, swelling or pus in the incision site. You have fever or chills, etc. Severe pain that's not improving, bulging again at the hernia site, these can be signs of complications and they need immediate attention. Recovery from hernia surgery is usually straightforward, but it does require a bit of patience and care. Follow your surgeon's instructions strictly, take it easy, reach out if anything feels off. If you found this video helpful, please like, share and subscribe for more videos on surgical health and recovery tips. And feel free to drop your questions in the comments below. Thanks for watching and take care for your health. Thank you.